I now call upon Dr. INDER RUSTAGI to speak on the topic documentation, how important it is in the CPA court.
Good morning. Documentation, how important in medical legal cases? Just now, Doctor has said that things have changed, so society has changed these days. And so keeping in pace of the society, have we also changed or just forget our old teaching? Mistrust in the society for doctors is increasing, as well as there is some kind of the degrading moral values of the few doctors and intolerance. And the most important thing is yellow journalism, that is aggregation of the news events, scandal mongerings, or these kind of dalals in between. Healthcare division in the multinational companies, lack of communication, poor record keeping, and problems with the medical fraternities. Mobocracy is the new thing. Uh, Something happens, mob creates the vandalism, and it is in the news. Yellow journalism comes. So a doctor is at the stake in recent cases of gynecologist in Rajasthan. So we have to change the attitude of the society. The call as money mongers or the predators, and we are healers and will remain the same. But the most important thing for assault or for medical legal cases is poor record keeping. Things have changed a lot. Doctors has to change. Family doctor concept is changing. So we also have to change. It is not the things as is used to be in the past to keep the hand on the shoulder and things are done. So we have to be precise and we have to have a proper record keeping. So medical record keeping is a science in itself. And the importance of the medical record keeping is it reflects and creates excellence in the medical care. It is a standard of care. It is a legal protection for the patient as well as physician in the dispute. Failure to document important details leads to adverse patient outcomes and malpractice suits. Another thing is ethical issue. It assures patient confidentiality and ensures that the standard of care are met. Poor records means poor defense, but no records means no defense. You're caught. So purpose of the proper patient medical records is patient care. It provides the documented basis for the planning patient care and treatment, and as well as a way of communication. Things TPA has come in between. So billing and reimbursement are the big way. Improper record keeping can result in the declining claims to the patient as well as to the hospital. Another thing is research and quality management. Legal documentation relies on documentary evidence in a situation if the medical negligence is alleged. So we have to have a proper documentation. Medical documentation consists of electronic health records. EMR is the thing in the work. Physical examination of the patient, consent forms, properly signed consent forms, especially in local languages. That is again in the system, and even our AIOS has come out with the local language consent forms. We have to have a full operative notes with proper timings. If you don't put timings and the case becomes medical legal, we are in trouble. Progress notes, nurses notes. So these things starts with itself. So safety starts with ourselves. Then comes physician or surgeon's notes, physician certification, physiotherapy notes, records with the batch number of the drugs which are specially used in eye, intraocular drugs, injections, viscose. Proper investigation, they have to be signed by the proper pathologist or microbiologist. Proper discharge with instructions like if you are not given instruction to the patient, the pain, watering, and redness has to be reported back. That again things becomes a medical legal issue. So dispensing summary given to the patient and in the hospital record, that should not be there. It causes a suspicion. Tampering with the medical records. And if tampering with the medical records is there, doctor is again caught in the, or doctor institute again caught in the civil court cases. Undated prescription land in doctor in trouble if the patient misuses it. So referral notes again are important part of the patient records. Always keep a duplicate copy of the referral notes with the patient signature that the patient was well informed or attendant were well informed in time whether they are not willing to take him to the another hospital or center, and something untoward happens to the patient, again doctor is held responsible, but patient doesn't go at his will. So doctor is at a safe point in medical legal cases. He is legally bound to maintain the confidentiality of the personal medical record. Illegible handwriting again becomes a case in medical legal cases. Lack of documentation, omitted medications, treatment, they all come under poor documentation. These days things are gadgets have come, so videotapes of the endoscopic procedure, phaco procedure, MICS procedures, electronic fetal health monitor chart, continuous ECGs or pulse oximeter, they become all important documents in the court of law. And another thing is those records which are indirectly related to the patient management, that is accounts, service records, administrative records of the staff itself, they sometimes become the evidences for litigation purpose. And it is a concentrated effort of a number of people which are involved in healthcare. But the center or onus lies on the doctor. Doctor is at the pivotal role. He is all responsible for his staff doings. Characteristics of the good medical record is it has to be accurate, it has to be accessible, it has to be comprehensive, it has to be consistent, and it has to be timely recorded. The issue of medical record keeping guidelines are that you have to maintain indoor records in standard pro forma for 3 years from the commencement of the treatment. Request for medical records by the patient or authorized attendant in some kind of referral or something, that has to be acknowledged and documented, has to be issued within 72 hours. We have to maintain a register of certificates with the full detail of the medical certificates issued with at least one identification mark of the patient and his signature, and effort should be made to computerize medical records for quick retrieval. It is advisable to maintain records for 2 years for outpatient. It is advisable for 2 years and 3 years for at least inpatient patient and surgical cases. In pediatric cases, up to the age of the majority, if the cases file against medical negligence, we have to have that record. And in death cases, permanent record keeping has to be there. Subject of medical legal cases has to be maintained until the final disposal of the cases, even though either a complaint or notice has been received. So by and large, medical records are the property of the hospital, and it is the responsibility of the hospital to maintain it properly. Records should be in a safe custody. Unsigned record has no value. Failure to provide medical records to patient on proper demand always amounts to deficiency in service and negligence. Medical records summon the court of law. They are used in criminal cases, RT cases, labor court cases, insurance claims, medical negligence claims. And sometimes becomes a criminal cases also. So there are the places where the medical records are of utmost importance. Policy for disposal of the cases are, once the time period is over as prescribed, by shredding or pulping according to the provision of the state laws, and details of the document destroyed by the hospital or the company has to be recorded in the register for proper disposable by employee who are disposing the records under proper orders for destructions. So proper documentation for patient record and in claims is important. That is to protect the doctor, to protect the institute, and to protect your patients. Obviously, you are the provider, so it is to be you are the at the center. Complete and accurate medical record keeping always help that your patient get the right care at the right time. So remember, be precise, up to date, and descriptive in records, come what may.